So, hello everyone. I am here yet again with another topper for the interview, and it fills me with so much pride to interview, young plastic surgeons, would-be plastic surgeons. So, welcome and congratulations, Dr. Yaswanth. How are
Thank you
you
so
feeling?
much, ma'am. Yes, I am feeling very much great, ma'am. It's a big achievement for me.
Absolutely, I can understand. So, for your introduction, I'd just like to give a small introduction of you to the candidates who are watching this interview. So, we have with us Dr. Menta Yaswanth Kashyap, and he's finished his MS just in 2023 in the summer. In June, he's finished. And so, he's a fresh aspirant, and that will make us believe that, yes, freshers have, so much a better chance than the people who have been into plastic surgery or whatever. I think it doesn't matter really, but then it's for the freshers that we say that you can do it. So this is yet another example of a fresher getting through the super specialty entrance exam. And so Dr. Yashwanth has done his MBBS from PES Institute of Medical Science and Research, and this is in Kuppam, Andhra Pradesh, and he himself belongs to Nellore in Andhra Pradesh, and he's done his MS from Sri Venkateshwar Medical College in Tirupati, and he's just finished in July 2023. So I mean, it's so you must be so relieved that you were in that preparatory cycle for just about 4 to 5 months, and you are here with the rank, and his again his AIIMS merit list is 4 and the combined merit list is 2. So such a great feat, and again, congratulations from the entire team of Marrow, and
Thank
of
you so
course,
much, ma'am.
I especially congratulate you. So just let us know about your preparation journey, and where did you find that was Marrow pivotal? Were the lectures that you saw, were they pivotal in your preparation and your rank?
Yes, madam. Madam, I have completed my MS in June only, ma'am. But I have given last INE also, ma'am. I was eligible for last INE
Oh,
exam also, ma'am. Yes, ma'am. I
all
have
right.
given,
Okay.
yes, madam. Last INE exam also, plastic surgery I have given, ma'am. But I was not
Okay.
qualified in stage 1 examination during that time, ma'am. Because I was preparing along with my theory examinations for MS and
Of
plastic
course. Yeah.
surgery both side by side, ma'am. At that time, I
Right.
have mainly concentrated on plastic surgery part, ma'am.
Hmm.
I have revised. First, I read the Sebiston textbook of both plastic surgery
Hmm.
and hand surgery topics in Sebiston textbook and burns in Sebiston textbook. Ma'am.
Hmm.
But I went
So
to the
that you were doing
examination.
in your MS itself, right?
Yes, madam. Yes, madam. During along with my MS preparation for plastic surgery, I have read the entire chapter detailedly. Yes, madam. And I try to
So
remember
when
all
did you
those topics.
decide that you wanted to become a plastic surgeon?
Madam, during my internship in MBBS, ma'am, I decided to become a plastic surgeon.
Oh, that long back you decided that you
As
wanted to
that
become.
long back only, I have decided, madam,
So
that I
any
wanted a plastic
particular,
surgeon.
thing or experience that you had with plastic surgery that made you
Uh,
think that you want to become a plastic surgeon?
Madam, at that time in our college, the plastic surgeon was freshly posted. Ma'am. Sir has completed his MCh and came to our college, ma'am. He is the first person to start department in our college, madam. Our MBBS
Oh,
college is a private college, ma'am. So sir is the
right, right.
first person to start the department, ma'am. At that time,
Oh,
during my internship only, I was the first person to posted in plastic surgery, ma'am. Before that, there is
oh,
no plastic surgery posting at all in our college, ma'am. So I
oh.
was posted for a
So that
duration of
means
one
he
month.
is one of the biggest, force
Yes,
which
madam. Yes,
actually
madam. Sir,
inspired. So we would like to know the name of the doctor also.
Sir is Dr. D. Pramod, ma'am.
Dr. D. Pramod.
D.
Okay,
Pramod. Yes,
wonderful.
ma'am.
So
Yes,
you
ma'am.
got influenced with his work and then you
Yes,
decided.
madam. I have decided. I have worked. Usually it is a 2 weeks posting, ma'am, but I requested for 2 more weeks and I stayed in that posting for 1 month, ma'am, during my
Oh,
internship. Only.
that's great.
At that time only, I have decided about plastic surgery, ma'am. So I
Okay.
opted for MS General Surgery and I opted for MCH Plastic Surgery.
Okay. So then during your MS, of course, first year is so
Yes, ma'am.
busy with the cases and everything. So when did you actually start preparing for your entrance?
Madam, I have started preparing for entrance in my final year only, ma'am. Along
Okay.
with my theory examinations, I have started preparing for this specialty entrance examination also. First, as I said, I have completed the Sebastian topics in order to get the basic idea about how will be the topics divided, how will be the questions can be asked and all. In order to get that basic idea, I have read the Sebastian textbook first. After knowing all the subtopics and all, before reading that, I also don't know that there are this much subtopics in plastic surgery, that we must know about all these topics in order to give our examination like that.
Yes.
So after that, I have read Grab and Smith once, ma'am. I have used Marrow QBank and Marrow videos mainly for this entrance examination, ma'am. For this INE October session, I have completed my Marrow question bank entirely, ma'am. Plastic surgery Marrow question bank.
Right. So after your MS, actually, after you answered your MS exam, then you started reading Grabs, right?
Yes, madam. Yes, madam. After completing my MS examination only, I have read.
Then you started reading Grabs. And side by side, you also watched the Marrow lectures.
Yes, madam. I have watched Marrow lectures and I have done Marrow question bank also. I have attempted all the Marrow plastic surgery grant test also.
Okay, so all that you have, like, so that means Marrow was end-to-end thorough you did, huh?
Yes, so I have used Marrow
once or twice.
Very much. Madam, end-to-end only question bank I have done twice, ma'am. For videos and grant test only once, ma'am.
Once, huh? So, I mean, when you decided about your, we can't say strategy really, because when you have less time, you just tend to, do whatever you can in that short time. But then, did you plan a way in which you'll do general plastic surgery, or you will read the advanced topics and all?
First, I have read entirely about the general plastic surgery. Ma'am, I have viewed all the videos of the general plastic surgery, and I have done the question bank in order to get the basic idea about flaps, graft, and the blood supply, how it will be different types of flaps and all. Because in our PG residency, we will see just pedicle flaps will be there. Very rarely we will see free flaps also. But we don't have any idea about these transpositions, island flaps and all. We also don't know any idea about them. Ma'am. And cleft lip and palate surgeries we have seen in our residency, ma'am, but we don't know exactly what are the steps will be taken during the surgery and all, ma'am. For those, I have seen all the videos of clefts and all. I have seen all the videos for ear reconstruction. I have seen the videos, ma'am. Those helped me a lot in order to know how the surgery will be done. In order to explain the surgery during interview, we need to know first how the surgery steps will be done. All those were, yes, ma'am. All those are clearly explained in the video, ma'am. And Marrow notes is also very helpful one, ma'am. By seeing video, we can see the notes parallelly by that side only. So it is very easy and to remember all the details and all. It is very helpful to us, ma'am. And Marrow QBank also covers few important topics that we will be missing while listening to videos and all. It's a good one. And Marrow grant test is a very elaborate one, madam. It will tell us that we must prepare more and more in order to succeed.
Yeah, so we've put in a lot of effort in, compiling all this so that, because you see what, different people come in with different timelines. Some people, they have 1 year to prepare. Then some will have only 3-4 months to prepare.
Yes.
So obviously, it has to cater to the need of a wide variety of aspirants. Somebody who is there in preparing for maybe a couple of years. So they have more time at hand. Somebody like you, they have just 3 months. So obviously people use these videos to their, how they can actually mold the preparation into how they find it suitable for themselves. So that is why we have tried to, cater to all of the, the aspirants, whether they have a background of plastic surgery or they don't have a background of plastic surgery. Because I feel exam is a totally different, it's a different ballgame altogether.
Yes,
you can never be fully prepared, and always the result is always a surprise. And so, did you expect that you will get such a nice rank?
No, madam. After my examination, I was confident that I will be qualified this time. For sure, I will be qualified in stage 1 examination. After giving interview, also my interview went so madam. It was not that much a great experience, because it's the first time for me facing the faculty like that. That they will ask the questions, I must answer immediately and all. So that point also helped me. During your previous interviews, I have seen that they will give you roughly 15 to 20 seconds for you in order to analyze the question and answer. You don't require to answer the question immediately and all. You have explained everything very nicely in your previous video, ma'am. I have seen all those and they helped me a lot. really.
Okay.
But during my interview, I was a bit flunked, ma'am. So I was not that much great during my
So
interview.
how many
So I
stations? You
was,
also had 5 stations
no,
in your
ma'am, we
stage
have
two?
total 7 stations, ma'am. I have total seven
7 stations
stations.
you had. And
Yes, ma'am.
what were the questions asked to you?
Madam, in one station, they have asked entirely about cleft lip and palate, ma'am, about all the
Okay.
classifications, about the surgeries, how the surgeries will be done, at what age the surgeries must be done, and everything, ma'am.
Hmm.
In second
Hmm.
station, they have asked about ear reconstruction, ma'am. How
Okay.
many types of surgeries are there? What are the different levels in the surgeries we will do for ear reconstruction? What are the ear
Hmm.
repair procedures and classification of ear disorders and all they have asked, ma'am. In
Oh,
one station, they
classification
have,
also they've
yes,
asked.
ma'am, they
This
have
is
asked
mostly
about
a theory
classification.
question that they've asked, huh?
Yes, ma'am. They have
Okay.
asked about classification also. In one
Hmm.
station, they have asked entirely about flaps, ma'am, about the
Hmm.
vascular supply of flaps and what is meant by propeller flap, what is meant by island flap, and all they have asked, ma'am, in one
Okay.
station. In
Okay.
one station, they have asked about burns, ma'am. What is the difference between fasciotomy and eschorotomy? And
Hmm.
how will you resuscitate a burns patient? And what is the emergency care we must provide to a burns patient? They have asked everything about burns, and they have asked a few questions about grafting also, ma'am. The difference
Grafting.
between split skin grafting, full thickness skin grafting, advantages and disadvantages, and how
Hmm.
we will do the full thickness grafting, and all they have asked, ma'am. In
Hmm.
one station, they have asked about congenital vascular anomalies, ma'am.
Okay.
All the vascular anomalies, classifications of the vascular anomalies, how will you treat those vascular anomalies, what are the lasers used for vascular anomalies, what are the
Oh,
drugs used for vascular anomalies. They have asked all those things in one station. In one
okay.
station, it is entirely combination, ma'am. Sir has touched everything, ma'am. He asked about history of plastic surgery, father of ancient plastic surgery, modern plastic surgery, what books
Okay.
Harold Gillis have written, and Sir
Right.
asked about flaps, cleft lip and palate, burns. What was the name of the ET tube used for cleft lip and palate surgeries?
Hmm.
Sir has asked
Hmm.
about the Dingman retractor and all, ma'am. Sir has touched
Hmm.
almost everything, ma'am. And one station is with HOD, sir, ma'am. Sir has asked to introduce ourselves and our experience in the plastic surgery and what made you to take up the plastic surgery and your previous any achievements and also has asked about all those things.
Hmm.
The interview went
My
like
God,
that, ma'am,
you
this
had
time.
a very elaborate stage two round, that means. And
Yes,
I'm,
madam.
yeah, yeah, and I feel so proud of you that you've answered all these questions. The
Not
congenital
all
vascular.
these questions, ma'am. I have
I mean,
answered only
see,
a few
you
questions,
are
ma'am.
here because you must have at
Master.
least answered
Yes,
relevantly, right? So
yes, madam. Yes, madam.
obviously, and this is like, from cleft lip palate to ear recon, flaps, burns, congenital vascular anomalies, everything. I think
Uh,
60% of plastic surgery is covered in your
uh,
in your stage two.
Yes,
So
yes, ma'am.
yeah, it
But
was a very
faculty were very nice, ma'am. Faculty were
hmm,
very nice, ma'am. They have
hmm,
assured that no, nothing will happen. Be cool. Answer our
hmm,
questions. If you don't know, it's not a problem. And then they were very friendly with us during the interview, ma'am. I
uh,
was a bit feared that how I can face the faculty like that, but they were very friendly with us, ma'am, during
um,
the interview. And the procedure was
so
also very smooth, ma'am. Interview
hmm,
procedure was also very smooth.
very small. So, I mean, yeah, this is a very exhaustive list that you have given for the next,
Ma'am, that
next
means
batch.
I want to help the next batch students, ma'am, in order to how to prepare for the stage two examination. Because for stage
Okay.
one examination, there were many people like you in order to guide us, ma'am. For stage two
Hmm.
examination, only students who have attempted the stage two only can guide us, ma'am. I have
Yes, true.
contacted the previous PGs in AIIMS also in order to know how the questions will be and all, how we
Oh.
must face the professors and all. It has helped
Hmm.
me a lot, ma'am. I have seen
Right.
your 2 years back video of stage two plastic surgery. It's a 1.5 hour video in YouTube, ma'am. You have
Oh,
explained everything about all the questions, what they will ask
yeah,
in our
that
examination.
was
Yes,
a
madam.
preparation. This time also, actually, we took a
Yes, madam.
webinar. This
Webinar, ma'am.
time,
Yes, madam.
yeah, this time also. And we for the last one, last INISS, I did a session on instruments as well.
Yes, madam.
So, full session on instruments I did. So, we're planning to make a lecture also on the instruments. So,
Yes.
so tell me your, I would say, top 5 points. I asked this to Dr. Vandana also yesterday. Top 5 points for the aspirants who are wanting to get into plastic surgery and answering the exams. So, I would want 5 takeaway points from you for them.
First important pointing I think is we must know all the sub branches in the plastic surgery, ma'am. in order to prepare for the examination, we must know what all sub branches are there and what we can expect from those questions. Second point I think is in INE SS examination, along with our super specialty, the general surgery part also plays a very important role.
Important role, yes.
Yes, ma'am. It's a 30 plus 50 type of pattern almost they are asking, ma'am. So the 30 questions also will play a major role, ma'am. I think that compared to plastic surgery, those general surgery questions were a bit simple in order to answer, ma'am. There will be a straight questions that if we have some idea about them, we can answer them easily. So we must, for my first INESS, that is the main mistake I have done, ma'am. I have mainly concentrated on plastic surgery. In my examination, I was confident with plastic surgery part, but I was very underconfident with my general surgery part, ma'am. But
Right.
yes, madam. In this attempt, I have prepared general surgery also side by side in order to attempt those questions also very nice, very. And the questions they asked were also very straight questions from Bailey and Seviston, ma'am. So I felt that it is a very helpful in order to read about this. And the last 2 to 3 days before the examination, the revision of all the important points is very much important because there are many names of the procedures and names of the flaps. In this examination also, they have asked many questions about the first person who have performed that flap, first person who performed this flap, what is the name of the flap based upon this artery and all, ma'am. So I think in order to remember all these questions, the 2 to 3 days before the examination, we must revise and all. We must make a note of these points in
Things
order
that
to
we can forget easily. So these things we should
easily,
keep for
ma'am.
the last. For
Yes,
the
ma'am. I
last.
think yes, ma'am. It's a very important one in order to attempt the examination. And the sleep before examination is very important, ma'am. Because
Yes.
INESS examination is very morning, ma'am. We must start by 7 o'clock or 6:30 in order to reach the our entrance examination center, ma'am.
Right.
So
Right.
the day before sleep and food is very important, ma'am. Because on the day of the morning, the breakfast will also not be a perfect one because we will visit to other cities in order to attempt
Yes.
the examination, ma'am. So I think we must travel safely one day before is the best option, ma'am. Usually we think that it is not a very important one. We can go morning and write the examination, ma'am. But I think that the sleep before examination is
I think
very important.
to keep your cool before the exam, you
The
need to rest.
examination, right,
So wonderful.
yes, madam. Giving grant test is also very important.
Giving
We
grant
need
test.
to give grant test as early as possible in order to know how we can shift from one topic to another topic, ma'am. In our Q banks, all the questions will be on the same topic, so we can retain the important points from the first question and provide the answer in the ninth or 10th question. But
True,
in
true, true.
cases of grant test, it is very important
All
in order to
mixed topics.
remember all the mixed topics, and we must jump from one topic to another topic. We must jump from general surgery to plastic surgery and again plastic surgery to general surgery. So
Yes.
it is also very important to give grant test for INESS examination. I think this will be helpful for my juniors and friends.
Yes, I'm sure a lot of them will contact you about, guiding them sail through this journey well. And I think you've done very well. And it. See, from your interview, what I can tell the candidates is that preparation is important because see,
Yes,
your mindset was there from the start that you wanted, to take a plastic surgery, and accordingly, like you're saying that you've been watching the interviews for so long now, so
yes, ma'am.
basically, that will is there, and you are wanting to put an extra effort towards that
Yes, ma'am.
end result. So that's
Yes,
very
ma'am.
important, I think, because see, lectures and videos, they are available to so many. It's not
Yes,
that
ma'am.
it's available to select, it's available to everyone, but how to utilize that I think that is an art that we all need to learn from you. And you've
Yes,
I feel very, very nice to have this interview with you, and
yes,
that
ma'am.
we feel proud. I feel proud as a Marrow faculty that the lectures have
Yes,
helped
ma'am.
you in this journey.
Thank you so
And
much, ma'am. Yes.
I'm sure that you will do very well. And we hope to meet someday in
Yes, sure, ma'am. It's my
the world
dream to meet you,
of
ma'am. My
so
first message to Marrow is also I want to contact Shilpi, madam.
thank you so much. Thank you.
Madam,
And
yes, my videos were very pleasant, ma'am. While watching the Marrow videos, we don't get any disinterest at all. They were very pleasant to watch, ma'am.
thank you so much. It is, it's
Yes,
so encouraging for me as a
yes,
faculty that, my lectures are liked and they're useful. More than liked, they're
yes, ma'am.
useful. So, um, you know, uh, Thank you so much for this interview, Dr. Yaswanth, and
Thank you,
welcome to the
madam.
world of plastic surgery. I'm sure you'll make a great plastic surgeon, and a lot of people will learn from you. And wish you all the best. Enjoy your time and relax now. I think that is, much due now. After your MS, you've not had time to relax, so this is the time. So
Yes, ma'am.
enjoy yourself, and many, many congratulations again, Dr.
Thank you
Yashwant.
so much, ma'am. Yes, ma'am. Thank you so much.
Thank you. Thank you.